So you get a UTI, you take antibiotics, you get better. A month later, another UTI, antibiotics, better. A month later, again and again. Your doc says, we better get some imaging. What are they looking for? Hey guys, this is Dr. Heps, and the question is, your doctor says there's a rock in your urinary tract and it's causing you to get all these urinary tract infections. What's going on? Well, we're going to investigate this and answer some of those questions, and make sure you stay tuned to the end of the video where we will go over some pearls of wisdom. So recurrent urinary tract infections are pretty miserable. We see a lot of patients with recurrent infections. They happen to men, they happen to ladies, all different ages. They cause frustration, they cause pain, they cause time off from work. They're just annoying, a problem. And as a urologist, we want to help you and eliminate these infections. But as a urologist, we want to make sure that there's nothing bad going on. And so how do we do this? Well, oftentimes, we will start with just an exam, talking to you, see what's going on, and in order to figure out if there's any source of these urinary tract infections, we will order a scan. A CT scan is probably the most common. We may start off with an ultrasound, but the goal here is to look for any kind of abnormality in your urinary tract that may be contributing to these urinary tract infections. We're basically looking for either a stone, a kink, cancer, anything that could be the source. Now, most people don't have any issues going on. We can't find anything, but occasionally we will find something. So, for example, if there's a polyp in the bladder, in the ureter, in the kidney, what happens is that bacteria, which normally just slides off the urinary lining, it can stick to those little polyps because those polyps have abnormal cells. And so when it gets stuck on these cells, what happens is you can get these recurrent symptoms of urinary tract infection. The other thing, a more common thing that we might see, are stones. Again, it can occur in the bladder, the ureter, and the kidney. And oftentimes there can be other symptoms than just infection, but we'll see folks that just have these recurrent infections and they just kind of get treated, and finally we get some imaging, and what do you know, they have a stone somewhere in their urinary tract. So stones are not like these smooth river rocks. They have all these little nasty nooks and crannies, and the bacteria love to stick to those nooks and crannies of the stone. What we think happens is certain bacteria can create this film, this kind of layer, where the bacteria can slide under and hide from the antibiotics. So what happens is you get a urinary tract infection, and the doc says, hey, let's treat you with a course of antibiotics. The antibiotics kill all the kind of free-floating bacteria, all the bacteria that's on the lining, but it won't kill the bacteria that's hidden under this, we call it biofilm or slime layer. You feel better initially because some of that bacteria has been eradicated, but over time, that bacteria that has hidden on these stones in that film reproduce, proliferate. Next thing you know, another infection, and you go down that road. So how do we diagnose these problems? Well, we get a scan, as mentioned, and we do an exam. Sometimes we'll include a cystoscopy, which is a quick procedure in the office where we look in the bladder. How do we treat these problems if you're having these recurrent UTIs and we find something such as a stone? Well, you got to get rid of the stone, because just throwing antibiotics at you isn't going to get rid of that biofilm, that bacteria that's in the nooks and crannies of that stone. So there's a whole slew of videos where we talk about different ways of treating stones. Bottom line here, recurrent UTIs happen. And as urologists, we want to make sure nothing bad's going on. In order to do that, oftentimes we'll do an exam and some imaging, either a CT scan or ultrasound. If there is something that we see, antibiotics are just a band-aid. We got to go after that stone or polyp or whatever it may be. Hopefully you enjoyed this video. Please check out our other videos on our library and subscribe. Thanks a lot.